Good morning, I'm Dr. Dangleben, and on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel, the topic of the day is Amlodipine, which is known as Norvasc, okay? Quite a few people are on Norvasc, and this is just a short bit on you understanding the medications that you're on, right? Amlodipine, Norvasc, is a calcium channel blocker, okay? And it's primarily used to treat high blood pressure and angina, which is the chest pain from coronary artery disease. Okay, that's important, all right? And the calcium channel blockers work by relaxing your blood vessel. If you relax the blood vessel, it makes it easier for the pump to pump the blood and lower your blood pressure, all right? Now, it has been shown that amlodipine is a second-line antihypertensive for Black people, all right? And there's studies to show that, all right? I talked about hydrochlorothiazide. I talked about the data in terms of, Black folks and stroke and kidney failure and heart attack, and that is the same, okay? Now, Norvasc has different ranges, right, based on how severe your disease is. It can range from 2.5 milligrams to 10 milligrams. Again, depending on your blood pressure. And again, the point is to go from, if you're up to 10 milligrams, to work your way down to 2.5, and maybe eventually even controlling your pressure to the point where you get off these medications, right? So there you have it. What are some of the side effects? It's a calcium channel blocker. And I want folks to listen to this very carefully, because somebody reached out to me recently and said, despite everything, I still have swelling in my feet and ankle, edema, right? Because it relaxes the blood vessel. Calcium channel blockers like Norvasc in a certain subset of patients, you get the ankle swelling, okay? So called the edema. All right, so it's not necessarily due to liver failure or heart failure, but that swelling in the leg could be related to your Norvasc, or just something to think about. All right, and because it relaxes the muscle, the vessel, you can get dizziness, you can get headaches and things like that. So just be, cognizant of that. And if you continue to have leg swelling, but it's working well for you, you can ask the doc whether or not you can benefit from a water pill, a diuretic. All right, so it's important that you monitor your blood pressure, all right, and pay attention to the potential complications that I mentioned, all right. And I want the doctors to educate their patient. Don't just write a script and tell the patient, here you go, take this for your blood pressure. Explain to them what you're giving them. All right? Right? We already have a huge distrust historically in terms of healthcare. Let's not make that any worse. Educate your patient on diet and exercise, especially reducing sodium and the amount of sodium, because again, we're a culture that consumes a lot of salt. All right? Norvasc, amlodipine is it's safe. It has a good profile. It's effective. And it's well tolerated, okay? So just something to think about, and don't forget the lifestyle changes. Don't forget your regular checkups, all right? And don't dismiss your symptoms. Don't dismiss your symptoms of severe high blood pressure, all right? We take these things for granted until it's too late, where we have kidney failure, where we have the stroke, and even death, right? So again, it's a plea. That's a plea from me to my community in taking care of these things. And many of us are dismissive and say, well, I'm going to go all natural. But again, too late is always the cry. Let's not get to that point, all right? I'm Dr. Dangleben on behalf of Patient Choice, all right, in Chemin, Neuf, Pointe Michel. Check us out. Have a great day. Peace.